Good evening, guys. Discussion D, we're going to take a look at America's healthcare system for elderly and disabled folks and things of that nature. So please join me for discussion D. Give me a few minutes to set for my notes, please, and I'll be right with you, folks. Okay. The line America's health system is collapsing and you're next is a deliberately provocative headline. It takes a sprawling structural issue, healthcare dysfunction, and reframes it as an immediate personal threat. Its purpose is not just to inform, but to alarm, to make readers feel that the crisis is no longer abstract but pressing and that their own well being is at stake. Alarmist framing. Words like collapsing and you're next invoke catastrophic and irreversibility, uh, direct address. By speaking to you, the headline collapses uh, distant distant between national policy and personal risk, ensuring the reader feels the implicated. Engagement strategy. This style is common in advocacy journalism, political commentary, or fundraising campaigns. It primes readers to click, share, and emotionally invest. Typical claims behind the headline. Surrounding content often builds a narrative of systematic fragility, drawing on several recruiting themes: systematic strain, hospitals, hospital closures in rural areas, long ER wait times, and supply shortages are framed as evidence of collapse. Financial pressure, raising premiums, medical debt, and insurance gaps highlight unsustainable economics. Workforce burnout. Doctors, nurses, doctors and nurses leaving the profession due to stress and underpayment are cited as signs of shrinking safety net. Policy failure, deregulation, privatization, or underfunding of public health infrastructure are blamed for weakening resilience. Together, these claims conduct a colossal chain: policy, economics, workforce stress, failing care that will eventually reach you. Uh, Prehistorical and structural devices. Expect the page to use anecdotes, patient stories of delayed care, or clinicians describing impossible workloads, statistics, selective data points like raising mortality rates or debt figures to qualify urgency, historical parallels, references to the COVID-19 pandemic or past recessions to suggest deja vu, calls to action, and encouragement to vote, donate, or support reforms, often framed as the only way to avert personal disaster. How to read it critically. Tone versus evidence. Emotional language doesn't equal proof. Look for credible data and sources. Scope: inflation. A local hospital crisis may be exaggerated into a national collapse. Check whether claims are regional or systematic. Solution bias. The page likely advocates a specific policy or reform. Note whose interests are served. Timeline clarity. Your next implies immediacy. Verify whether the article supports short-term collapse or long-term erosion. Bottom line, the phrase is a strategic headline, a blend of fear, appeal, and personalization. The surrounding page likely argues that America's healthcare system is underserved, strained from cost, staffing shortages, and policy failures, that ordinarily people will soon feel the consequences. It's less a neutral observation than a rhetorical device designed to mobilize readers toward a particular interpretation or action. Would you like me to break down how this kind of framing compares to more neutral health policy reporting so you can see the difference in persuasion and techniques? Okay, guys, there's a reason I did this show also. Because this makes the point that America's healthcare system is on the verge of collapse. Yes. But it starts with federal guidelines. Federal guidelines are falling apart because infrastructure, when it gets to local hospitals, the infrastructure falls apart also. So your care has a tendency to fluctuate. People have the tendency to prioritize one condition over another, or somebody's illness is more urgent than others, which happens usually, typically. But you have to look at healthcare system with a practical eye. You have to see, how things are for people. People have to take and break everything down so that they understand in their own language what goes on in life. For healthcare, like I said, it depends on a person's situation. Now, for an elderly person, let's say, for example, for me to explain this, let me say, for example, that Aunt Sally goes in to the hospital into the emergency room. She comes in by ambulance or car, but she may have an urgent issue, but they push her aside or something. because somebody else comes in with a more urgent need. Um, that happens in everybody. That happens everywhere. Um, that's why I did the show, to show that people people see healthcare. It's a major need for people, but it has to be structured right. And when it's not, there are major gaps in care for elderly, for disabled, um, which there's no need for if it's set right. I mean, really, come on. Everybody deserves the same kind of care, but that doesn't happen because, I mean, in life, somebody gets picked over somebody else for care first. Somebody has um, bias by people. There's, I've seen it where people go in with an urgent need, and let's say nurses, and they go into the ER bay, but an accident shows up with a critical person that is hurt, so that person gets pushed to the top for care. You may have an urgent need for care, but maybe you can wait for, maybe you can wait and like for a little bit, but it shouldn't be that way. Everybody should have the same care across the board, as far as I'm concerned. But it, like I said, care depends on if you have what your situation is physical. Care for elderly people um depends on how physically they are, age related issues, how fast they get to trauma centers. It also depends on how severe the issue is going on, and how quickly they can get services for medical issues. So that is why I did tonight's show for D, um, just to show that there are holes in America's healthcare system when it comes to certain folks, certain situations. Um, I find it pretty funny that hospitals, I think some hospitals pick and choose about how they give somebody care. Um, because I've seen it myself. So for some folks, um, like I said, somebody goes in for what they think is an emergency, and they get pushed aside for something else that comes in the door. Well, that person has the same right for care, but it depends on your level of trauma when somebody shows up to the hospital. That's as far as I'm concerned. So, I just did this show for an FYI for everybody. Hope this helps somebody. Uh, I'll do another show later. For now, Gator Wellness. Take care, folks.